Hi, I'm Gabby, and this is my mentor, Dr. Phyllis Orr, and I'll be conducting an interview to find out a little more about the field of psychology. Okay, the first question is, what surprised you the most when you actually got your job in the field?
I think it was for me a wake up call that I was actually an adult now and that I had a real job and that all the things that I've been using and learning in graduate school, I had to now start doing in real life, even more so than when I was on externships or internships when I was a student. So this was the real world.
Yeah.
And I guess that's what surprised me the most was like, wow, this isn't practice anymore. This is real.
Mm-hmm. Okay, what's the biggest myth about your field?
I think being a clinical psychologist, you get the tools to help people, and you really try to make it work. But I think a myth is that if you use therapy the right way, it's always going to work, and it doesn't always work.
Yeah.
It's complicated, and I think the myth that we can help if we just do this one type of treatment the right way is just not true. It is complicated doing therapy, especially when you're doing therapy with children and adolescents. There's just so many things that as a therapist you can't control for. So it's not a matter of just using the best treatment out there. It's really learning how to connect with your client and how to understand how complicated their lives are.
Right. What's the biggest obstacle or the obstacle most occurring with your clients?
Well, my clients are children and they're preteens and they're teens. And I find that they're not coming in for therapy because they woke up one morning and said, I really would like to learn how to change my life and make things better. They're getting dragged in by their parents. And very often it's a battle to it's a battle of wills. And when they come in here, they don't want to be here. They don't want to necessarily do the things that I'm wanting them to do, and it's not easy in therapy. So I'm asking them to do some very difficult things, and engaging them in therapy is really the biggest obstacle because they're not there of their own free will, many of them. Many of them are being threatened by their parents. They're being told you can't come back to school unless you meet with somebody. So they're not there wanting to be there with me.
Mm-hmm.
And the biggest obstacle is trying to connect and trying to understand what's meaningful in the clients that I have, meaningful enough for them to come here every week and work hard with me to make change.
Yeah. What are the most challenging parts about your job, and does anything make you regret choosing this for your job?
Okay, the most challenging parts, I think, well, there's different things about my particular job. So I'm a clinical psychologist, but also at Hofstra University, I am a supervisor here, a professor in the clinical psychology program. And the most challenging part is supervising students because they're telling me how hard it is doing therapy and how can I help them, should they change what they're doing. And because I'm not there in the room, I don't know sometimes what the right answer is. I could just give it my best shot.
Mm-hmm.
And I think that the challenging part is getting it right.
Yeah.
That there's not always a right answer, and having to do this sometimes from 9 to 5, have students come in and say, what should I do? My client is concerned about this, or the parent wants me to do this. And at the end of the day, my brain is tired.
Yeah.
So I find that challenging. And if I regret anything, it's taking on too many things at once, trying to be a professor, trying to be a supervisor, trying to open up a clinic, trying to do my own clinical work. So maybe it's not knowing how to say no and set my own limits.
Right. What is your favorite thing about your job?
Well, it's the students and my clients, connecting with people, learning about people, learning about their passions. That makes me feel good. I like people, and I enjoy hearing their stories. And it's knowing that I've made a change or that I've made a connection makes it very, very worthwhile.
Mm-hmm.
My least favorite, I have to throw that in, is paperwork, by the way.
Yes.
I'm the worst with paperwork. But my most favorite is working with the clients that I meet through the years. I make strong connections, and the students as well.
What's the best advice and the best warning that you can give somebody interested in this field?
I think the best advice is learning to really accept that you could only do your best, and that you could still make mistakes doing your best, and not to beat yourself up about any mistake that you make.
Right.
In the field. Just keep trying to learn more, and just listen and not judge, and be if you can as genuine with either the students you happen to be involved with or the clients. Just really learning how to be yourself with them.
Right. If there was one thing that you wish that your clients knew about your profession, what would it be?
Probably that we don't know it all.
Mm-hmm.
And we don't, and that we do make mistakes, and we struggle to figure out how to help the people that we're working with, but that there's no guidebook there. There's suggested ways of trying to help people, but sometimes we don't know necessarily if we're going in the right direction.
Right.
And it's constant, thinking and doubting ourselves and making sure that we are doing the best that we can. But it's that we still have a lot to learn, and we're always making sure that we're doing the right thing, but we're certainly far from perfect.